bubble. As we speak, my mom is reaching hour 12 of her shift of taking care of COVID-19 patients in the ICUs of various North Shore Healthcare System hospitals across Cook County. After only 1 week, she has told me that almost all of the ICUs at each hospital are at capacity. My dad, who works at the Jesse Brown Veterans Affairs Medical Center, has confided in me that the situation there is getting worse by the day, very similarly. The fact is that we do not have the infrastructure to support any unnecessary cases. The fact that the faculty is still being asked to go to New Trier is idiotic, dangerous, and shows a lack of regard for the livelihood of the educators and faculty who have shaped me into the person I am today. In fact, I have heard from several teachers about the gross misconduct of the administration. A teacher who has been going through chemotherapy has told me that they were being shamed for not teaching in person. Another stated they were told in-person schooling would end once positivity rate in the community reached 5%. But the administration went back on their word as the positivity rate has surpassed that. All that I ask of you is that you stop endangering the lives of my educators, the faculty, my fellow students, the families of said individuals, and even my own parents. Continuing this idiocy will only result in the deaths on your hands. And I would just like to say that every single person who has talked about the science behind COVID-19 has grossly misrepresented all of the facts. My parents know exactly what this is like. Thank you.
Okay, next, James Wright.
My name is James Wright, and I teach in the Social Studies department. Those who know me well know that it is out of character for me to make a speech like this. Most often, I go about my work and do what I'm told to the best of my abilities. But the fact that we have run out of accommodations for our teachers is a clear sign that hybrid learning is currently unsustainable. We are not simply replaceable, so we need to return to remote learning. I know that some of our students struggle academically and emotionally. I teach some of them, and I also worry about them. Parents, I get why you want your children back in the building. For some of you, it feels like if your kids could only get into the classroom, things would feel more normal again. But I'm also a parent, and my daughter, who is in 6th grade, has been in remote learning this entire time. Although it hasn't been easy for her, I would never expect her teachers and other school staff to risk their health for her sake, especially not right now. And there are misconceptions about what hybrid learning looks like. When the students learn in person, they're often still on Zoom for a significant portion of the time. They must remain facing forward in their seats for 70 minutes and have little chance to comfortably socialize with their peers. As a result of these restrictions and rising metrics in the area, some students who have been scheduled to come in the building have chosen not to. I had one student present in person in a class on Friday. Furthermore, even in the remote environment, our students are still receiving some of the best educational experiences anywhere. With increased support from staff members and parents, I have seen struggling students bounce back. To continue supporting them, let's spend at least as much on extra academic support and mental health professionals as we have on saliva tests and technology. I will keep doing my best for my students no matter what comes in the next months. But I beg you to have the humility to learn from this challenging year. Our school is exceptional, but we're not exempt from the effects of this pandemic. I know that you have worked tirelessly to make hybrid learning work, but we are too connected to the rest of the world for us to try to remain on an island. Over and over again, we've heard stories of how, despite preventive testing and best intentions, this virus spreads and people suffer and die. We don't want to be a tragic news story about the lives lost and mistakes made. By continuing to innovate in the remote environment and investing resources in a targeted way, we'll be showing our students that they can persevere through dark times and do so for the sake of our entire community. That is compassion. That is lives to the service to humanity. Thank you.
Next, Izzy Hester. Hi, my name is Izzy Hester, and I'm a senior at New Trier. First and foremost, along with many of my peers, I am concerned that the reopening plan that the Board of Education is following is advancing very fast, much faster than it should be. The decisions to move forward towards stage 3 of the reopening, in which students with learning difficulties return in person, was understandable and necessary. These are students whose education has been significantly impacted by remote learning. For the rest of New Trier, all I can say is that we're fine. It's not great, but we're fine. The reopening decisions being made are being made at the expense of the health of teachers and support staff. I am concerned because staff are being given little option returning to schools, with many teachers being denied accommodations. At the last board meeting, Helen Oshana, who works in the Health Services Department, spoke on how she has been forced to choose between her livelihood and the health of her children. Many of my peers and I would just like to know why these staff are being forced to make this choice, because frankly, we don't see any justification for them being forced to put their health at risk. I value my teachers' health more than in-person learning, and I refuse to listen to people disrespect my teachers, many of whom have young children at home that they must protect. Second of all, I'm concerned about the message this sends to the student body. It is incredibly concerning that this reopening is occurring at a point in time in which our state is hitting coronavirus records, and not good ones. According to new data just released by the Illinois Department of Public Health, in the past week, there's been an average of nearly 5,000 COVID-19 patients in hospital beds across the state, the highest average on record. You have established that your stance is that the saliva testing data trumps the rising metrics in our community. However, the issue I'm addressing is the message that you are sending. Moving back into hybrid tells students that things are improving. You cannot control what your school of 4,000 students do outside of school. If school is reopening, some students have and are going to take that as justification to take more risks. Opening the school tells people that our community is safer than it was when we were remote, but our community is not safer. The numbers say this. J.B. Pritzker is warning that we are on the verge of another stay-at-home order. That is not an indicator of a safe community. I understand that there is a lot of pressure on the board from parents and students alike to reopen New Trier further and to keep New Trier open, because learning is hard in a remote. It's much harder. I get it. I definitely find it harder to focus. And believe me, I understand the impact this has had on mental health, as many people have talked about. But the details of this, I do not owe anyone, but I guarantee you I understand the impact it has had. This has not been easy, but this is not a matter of comfort. This has been uncomfortable for everyone. I want my senior year as well, but I can recognize that there is no case in which the complaints of a student about distractions due to Zoom or about missing their prom or senior year should be valued higher than the health of the nurses at our school, higher than the health of the staff as a whole. Right now, when hundreds of people across the state are dying, missing out on my senior year just really doesn't seem like an issue of utmost importance. I value my teachers much more than my senior year.
Victoria Chan.
Hi, my name is Victoria Chan, and I'd like to make a joint public comment from myself and on the behalf of Eva Reutberg, and we are both seniors at New Trier, and she apologizes for not being able to be here today because she has 2 autoimmune diseases and is thus high risk for COVID-19, but she is watching the meeting from home. I would like to make a comment about reopening from a student's perspective. There are 2 phenomena I would like to make the board aware of. First is that for the past few months, I have seen social media post after social media post of New Trier students partying. They will huddle together in someone's basement, maybe 10, 20, and sometimes even 30 students without masks or any semblance of social distancing. While in March and April, it seemed as though students were obeying lockdown orders, but as COVID fatigue began to set in, they resumed these parties and haven't stopped, despite cases now being as high as they were in March. The second phenomenon is that students have posted pictures and videos of themselves at school, hiding with their friends in some unmonitored areas of the building with their masks pulled down to their chins. Of course, this is not every student, but I've seen at least 3 to 4 different kids post videos of them hiding in the bathrooms, in the hallways, and other areas that are clearly not designated lunch or free period spaces in order to hang out with their friends maskless. If either of these pieces of information come as a surprise to the board, then they clearly haven't thought enough about the basic nature of teenagers. The area of our brains that is designed for complex actions like impulse control, planning, and complex reasoning, called the prefrontal cortex, is not fully developed in adolescence. Our neurobiological immaturities predispose us to taking risky behaviors, even when we know it could hurt ourselves and others. We are also uniquely susceptible to peer influence, so it is not surprising that our most egregious social distancing violations have been things like partying or hanging out with friends at school. Blaming teenagers for their illicit socializing is like faulting a bird for leaving the nest. It runs counter to a basic biological imperative. But the problem is that this reopening plan places the safety of the staff, the students, and the students' families on the trust that teenagers will override their basic biological imperatives for the safety of others. We don't work like that, and we never will, regardless of the Trevian pledges we sign. So this board has two options. It can A, continue putting blind faith in teenagers to assess risks properly and open to 50%, giving students even more of a social incentive to hang out with their friends unmonitored. Or B, accept that there is a real risk of COVID spread at school since teenagers will be teenagers and they are partying and not wearing masks properly. So, which will you pick? Thank you.
Jen,
Jen McDonough?
Good evening. I'm Jen McDonough, and I'm the president of the New Trier Education Association. While we continue to support in-person instruction that is safe and effective for all students and staff, we ask that the administration and the Board of Education take the following into consideration. Continue to prioritize our students with the highest needs. The association's members have been working tirelessly with administration to prioritize our students who are most in need. Currently, New Trier is operating at 25% in-class attendance for students, with those who need extra support attending as many as 4 days a week. At 25%, the school has seats available for students who truly need the in-person experience. If the administration and board rush to 50% of students in the buildings, we may exceed our capacity to prioritize those students who most need to be there. The committees that have been formed with the administration to review and consider adaptations to the school model is a good first step in building a better model together, and we look forward to that work with the administration. We also call to keep our students and our staff safe. While the saliva screener provides one possible path to safe in-person instruction, additional metrics and thresholds should also be weighed equally. An important future metric should be maintaining a proactively stated high participation percentage for all in-building students and staff, and subsequently monitoring for a low positivity rate. We want to begin emphasizing the importance of these new measures now that the administration has suddenly eliminated existing RAB rate and case metrics in exchange for voluntary screening. All screening models must prevent asymptomatic positive people from entering the building, and this must occur in a transparent manner. All previous mitigation strategies must be enforced, and the screener must not supply a false sense of security. Importantly, the possibility of schools contributing to case counts must make us responsibly consider the surrounding hospital's ability to provide advanced care. We cannot ignore the fact that adaptive pauses have recently been enacted in school districts 225 and 211, as well as many area elementary schools until mid-January. In the letter to the District 225 families, a message from the Chief Medical Officer of the Cook County Department of Public Health stated that schools should strongly consider remote learning given the presence of sustained community transmission. While continuing to prioritize in-person learning for struggling students, New Trier should also consider an adaptive pause for students who are not struggling at this time, previously defined as Step 3. As we head into the holiday season, we know that travel and group gatherings will continue to exacerbate the current risk levels. We agree with community members who advocate for students and teachers who have health concerns and be given an online option. However, those community members should know that while students have been given an option, New Trier teachers with health concerns have had to fight for these accommodations, fight to keep them, and are now contending with accommodations being denied in an inequitable fashion. Our association sees the continuation of accommodations for our most vulnerable members as an absolute priority. Without those accommodations, teachers will be forced on leaves, substitutes who are hard to find will take over classes, and staffing will become problematic. And some teachers will simply need to be remote until a vaccine is developed and deployed. While we are professional educators and work long hours to support our students, many of our faculty who are also working parents whose own students have had to continue under remote learning. There are those who cannot safely bring their children to school or leave them elsewhere. We ask that the board and administration to consider this. Thank you.
So next, Rusty, is it Magner?
Yeah. Hi, good evening. My name is Rusty Magner. I live in Northfield, and I've got 4 children who are graduates of New Trier. My youngest is a junior at New Trier. My wife is a substitute teacher at Faith, Hope, and Charity, which is open 5 days a week for learning for all the kids. We love New Trier, but my son needs to be here every day. Can you please make that an option for those students who want to be in class every day? He's a level 2 student. He needs to be here. He misses school greatly, both from a learning standpoint and a social standpoint. And the Zoom is just not cutting it, or coming in just occasionally is not cutting it. He needs to be here every single day, and he needs to be given the option to do that every single day. Mental health, as you've heard from plenty of other parents, is a big issue for kids, for all of us. And there's so many kids committing suicide, contemplating suicide on antidepressants, and it's getting worse. My son talks about how more kids are dying from suicide than COVID by a wide margin. If the school board and the administration and the teachers are working in the best interest of the students, then students and teachers should be in the classroom, period. Teachers are frontline workers like so many others, but the others didn't stop working when the pandemic hit. They work in healthcare, retail, restaurants, and more. They've been working at their workplace for the past 8 months, often at a fraction of a New Trier teacher salary. We cannot wait until the pandemic is stopped. It may never be stopped, and our children cannot wait that long. The mental challenge is real. You've heard plenty of other parents talk about survival rate and the progress we've made in COVID. Life is full of risks. We know and understand many of them. We take precautions. Again, we love New Trier. This is our 5th child here. I went to Loyola Academy right down the street. Loyola is open, 50%. The kids are there every day. I'm asking the board, I understand the school spends over $27,000 per student per year. Can I get a voucher and send my child to Loyola Academy for a 2nd semester if New Trier is not going to be open? I want to see how that works. We need to have options. We need to be open. We need to be open immediately. Thank you.
Lisa Kinsella?
Hi, my name is Lisa Kinsella, and I'm the mom of 5. 2 are here at New Trier, and 3 are stepchildren at Lake Forest High School. I have firsthand experience of the contrast. It's stark. We've heard today the numbers, the real true data. This is not fatal. Our kids need to be in this school. If not now, when? Do we wait for a vaccine? Another year, 6 months, 9 months? How long will it take? I ask you, if not now, when? They need to be in school. My husband runs an essential business. He has 65 employees. How are teachers not more essential than his business? They've worked to put structure in place. They have fail-safe, much like New Trier has. You've done the ventilation. You've added the saliva screening. You've added the mask, the plexiglassing, the distancing. You've done all that you need to do. It's time for our kids to come back. You've listened to the union leaders. Their grievance is for a small minority. We cannot have the tail wag the dog. I was on parent-teacher conferences today. I spoke with 12 teachers. 11 of the 12, of their own volition, expressed to me their desire to come back, their desire to have the kids back. Please, if not now, when? Make it work. We can all make it work for the betterment of these kids, for their well-being. Thank you.
Hannah Sussman?
Hi, everyone. My name is Hannah Sussman, and I'm a senior at New Trier. I'd like to start by thanking New Trier for the experience that it's given me. My teachers have had impacts on every facet of my life. They've been there after school to support me. They've constantly given up free periods in order to work with me, whether that's on an issue of school, not understanding physics, or something that's personal and happening, and they're to support me. My teachers are not replaceable. They have been there for me at every stage that I've gone through throughout high school, and they've taught me so much about who I am and who I should be in every case scenario. And of the biggest things that they've taught me, it's standing up for what you believe in and what you believe is right. And I believe that sending teachers back to school and forcing their hands at coming back to school is wrong. You have created a wonderful staff, and it is not replaceable. You cannot just substitute in another teacher, and trying to force their hands and make them come back to school undervalues how much they add to the school curriculum. I understand that students are struggling with mental health, and I understand that there's a lot of pressure to reopen, but teachers don't need